And dementia is not one disease. It's a group of brain disorders with different causes. Some causes of memory decline are treatable, so the workup really matters. Early evaluation can change quality of life, safety, even treatment option. Um, and the best dementia treatment often starts years before symptoms appear. That is prevention. Hello, everybody. I'm Dr. PK. Today, we are going to talk about a very important topic that affects millions of families around the world, and that is dementia. Dementia is not a single disease, it is a syndrome, meaning a group of symptoms caused by different brain disorders. Many people use the word Alzheimer's and dementia as if they are the same thing. They are not exactly the same. Alzheimer's disease is one type of dementia and is most common type, but there are several other types and each can look a little different. So in this video, I'll explain different types, how to reduce risk, and what we do, what kind of workup and the treatment option. So dementia means a decline in thinking abilities that is serious enough to interfere with your daily life. This involves memory loss, judgment issue, language difficulty, confusion, trouble planning, getting lost, personality change, behavioral changes, or difficulty doing familiar tasks. Now, this is very important. Normal aging is not same as dementia. As people age, they may forget names occasionally, misplace glasses, need more time to learn something new. This can happen. This can happen with normal aging. My mother is 85 years old. She's very sharp. I mean, for her age, she does everything on her own, but sometimes she forgets here and there. That's not dementia. But dementia is different. Dementia, the decline becomes more persistent and it begins to affect your independence, safety, work, finances, medication, driving, cooking, personal care. So that's the difference. Major types of dementia. Number one, the top one is Alzheimer's disease. This is the most common cause of dementia. It usually starts slowly and gradually worsens over time. Typically, early signs include short memory loss, short term. They will forget what they ate for breakfast. Or they ask the question, they got the answer, they forgot what the answer was. They're going to keep repeating questions, forgetting recent conversation about anything, misplacing items, trouble finding words. They know they want to say something, but they're unable to vocalize, and difficulty managing complex tasks which they were able to do before. And as it progresses, people may develop disorientation, poor judgment, mood changes, wandering, and problems with activities of daily life. So biologically, Alzheimer's is linked to abnormal buildup of amyloid and tau proteins in brain. Modern diagnosis increasingly uses biomarkers to help support the diagnosis in the right setting. Number two is vascular dementia. This happens when thinking problems are related to reduced blood flow or damage to blood vessels in brain. It may occur after a stroke, multiple mini stroke, chronic small vessels disease. Those patients will have chronic small vessel disease, uncontrolled blood pressure, diabetes, smoking, high cholesterol. And symptoms can vary, but common patterns include slow thinking, poor attention, executive dysfunction, gait issues, mood changes, memory problem. Sometimes the decline is stepwise, meaning the person worsens after each vascular event rather than in one slow, smooth curve. This is one reason prevention is so important, because controlling vascular factors really protect brain. For example, if you control the blood pressure well, diabetes well, you're a non-smoker, your lipidemia is well controlled, then your chance of vascular dementia is gonna be much less, much diminished. Number three, dementia with Lewy bodies. This is often under-recognized. People may have fluctuation in alertness and attention, they have a detailed visual hallucination. They'll start seeing people in the room, and some their dad and their people who have been long dead. They will see those folks, and they start moving more like shuffling gait, and they have features of Parkinson's disease. They lack facial expression, not much extra movements in the body, and they walk very slowly in small step. They have stiffness kind of in their body, and they walk very slowly. They also act out on their dreams. They may throw things at night time in their room, and so memory may not be the first or main problem at the beginning in this case of dementia. The earliest issue is in this case of dementia, called dementia with Lewy bodies, is attention and hallucination and the movement change. This type is very important to recognize because the treatment choices and medication and sensitivity can be different. There are still no FDA approved drugs specifically for DLB, though some medication used in Alzheimer's may help in selected patients. So DLB is basically dementia due to Lewy bodies. Then fourth one is frontotemporal dementia, FTD. This often appears earlier than Alzheimer's, sometime in people in the 40s, 50s, and 60s. And frontotemporal dementia, the name indicates, it affects your frontal and temporal lobes. So symptoms may begin with the personality changes, loss of social judgment, impulsive behavior, apathy, reduced empathy, compulsive behavior, language problems, unusual eating patterns. Some patients seem psychiatric at first because the earliest symptoms, earliest signs are behavioral rather than memory related. This is one of the key reasons not to assume all dementia starts with the forgetfulness. So forgetfulness, that is one of the main thing happening with Alzheimer's, but other dementia, you have other symptoms, and that is in frontotemporal dementia, you have personality changes, impulsive behavior, and reduced empathy. Take an example. I'll give you an example. All of a sudden, your grandpa, who is or your dad, 70 years old, all of a sudden he becomes cruel to the pets in the house, and he's impulsive now, and this. So you can see that this kind of changes happening is only indicates frontotemporal dementia. But if that same person has some hallucination of seeing his older family members who have been dead for decades showing up in the room or in the family room or bedroom, and they have a slow shuffling gait, more stiff posture, those are indicative of dementia with Lewy bodies. Mixed dementia, many older adults do not have only one process. They may have Alzheimer plus vascular brain injury or Lewy's body. That's more common in real life. There are other types of dementia, very rare because of Parkinson's disease dementia, Huntington disease dementia, Creutzfeldt-Jakob disease, normal pressure hydrocephalus, alcohol-related brain injury, traumatic brain injury, HIV-related cognitive disorder, and other neurological and inflammatory conditions. Some could be because of lack of B12, thyroid disease, delirium, dehydration, substance abuse, metabolic disorder, sleep apnea, depression, medication side effect. This is my first video. There will be, I think, one or two more videos about dementia. So I'm going to see you in the next video about dementia. Thank you for watching. Happy Monday.